add a compound like guaiacol, they will stabilize the oxygen radicals. So we increase the production of oxygen radicals by combining two enzymes, and we stabilize this radical by adding guaiacol. And this way we start, in fact, from the honey concept, which is modified, improved to have a far superior antibacterial effect. So let's have a look at it. We start, of course, like in honey, with glucose, water, and oxygen. And glucose oxidase produces a peroxide ion. Lactoperoxidase will capture this peroxide and transforms it into reactive oxygen species. Now, the advantage of using lactoperoxidase is that lactoperoxidase binds only to microbial cell walls, which means that this process, basically the creation of the active ingredient, will only take place in the vicinity of the microbial cell wall, which means that it will be active against microorganisms, but it will be unharmful against human cells. Why? Because this lactoperoxidase will not bind to human cells. There will be no reactive oxygen species nearby human cells, and there will be no toxicity to human cells, which you can see here. The lactoperoxidase you see here, there is no receptor on human cells for this enzyme, so it will continue its way until it finds a receptor on bacterial cells, and there it will liberate its oxygen radicals and destroy the bacterial cell wall, and only there. We saw in the beginning the main disadvantage for the continuous use of antiseptics and antimicrobial agents in general was its cytotoxicity. Its toxicity to newly formed human cells, newly formed in the process of wound healing. Now, this selective mechanism gives us an advantage to this, so that we don't have to compromise anymore. If you have a wound full of necrotic tissue and probably full of bacteria, you can choose either to treat it with antimicrobial agents to prevent infection or to try to prevent infection. But then you know that due to the toxicity of these antimicrobial agents, wound healing will be slower. Or you can choose to put non-toxic products on the wound, but then they will not contain any antimicrobial agent. Wound healing will be quicker, but you run a risk of infection. With this enzyme system, you can combine both because of this selective transportation mechanism. It's basically a very old active ingredient, reactive oxygen, but combined with these enzymes, you have this selective transportation. We've been running some tests on this system on several bacteria, and it works quickly. One of the most important bacteria, of course, is Staph aureus, and you see that within 1 hour, almost every bacteria is killed. We've been doing several tests on multi-resistant bacteria, because resistance is such an important issue. You see Staph aureus again, a MRSA. Huh? You will see Pseudomonas again. You will see a multi-resistant E. coli, Enterococcus faecalis. And every time we've been measuring what you see here is the minimal inhibitory concentration and the minimal bactericidal concentration. So inhibitory means bacteria cannot multiply anymore. MBC means living bacteria are killed. So combining glucose oxidase with a lactoperoxidase and then again with this guaiacol greatly enhanced the antimicrobial mechanism of the glucose oxidase, or the antimicrobial activity. Here you see in detail what happens if you put increasing concentrations of this enzyme system on a Staph aureus broth. You will see that with the lower concentrations, the bacteria will grow, and as soon as concentrations get to 0.04, there is no bacterial growth. That's how we determine MIC and MBC. You have the same, for example, Pseudomonas aeruginosa. At low concentrations, like the blue one, 0, or the pink one, you get bacterial growth. The higher you get at a certain moment, it stops. It works. But I told you then that we leave human cells in peace. We do not disturb the metabolism of human skin cells, unlike other antiseptics and antimicrobial agents. Is this true? This also we can test. We can put keratinocytes or fibroblasts in culture, add antimicrobial agents to it, and see how many of them will be killed or how many of them survive, which is what we did. Either this is basically placebo-controlled, this is a known antiseptic toxic agent, and then we tried the enzyme system in different concentrations. And what we see is that you even get more cells in solution when you put the enzyme system than when you put nothing at all. So there is no toxicity to human cells. We compare this to other antimicrobial agents. For example, here you've got water, which is control, iodine, fusidinic acid, an antibiotic, silver, and again, enzyme system. A regular hydrogel, and this is a regular alginate gel. As soon as you start adding iodine, antibiotics like fusidinic acid, or silver to the medium, your cells, human cells, keratinocytes, fibroblasts, die. So the number of surviving cells is greatly smaller as soon as you use them. When you use this antimicrobial enzyme system, there is no interference basically with human cells. So we have ourselves here a selective antimicrobial system. With increasing bacterial resistance, these data show that this enzyme system, glucose oxidase, lactoperoxidase, guaiacol, is to be considered as a valid alternative to antiseptics and topical antibiotics. We were able to prove that low concentrations of this enzyme system inhibit growth of all antibiotic-resistant strains. Low concentrations of this system are bactericidal for antibiotic-resistant strains tested. And finally, it is a non-toxic system towards keratinocytes and fibroblast human skin cells. I would like to thank the University of Brussels that gave us the resistant strains and which allowed us to do these tests. Finally, what did we learn, hopefully? Well, what I wanted you to tell is that basically treating a clinically established infection is not easy because we don't have the proper means, no ideal solution. Antibiotics systemically do not get to the underlying tissue because a wound will be ischemic, especially chronic wounds will be ischemic, but burns equally ischemic. So it's difficult to treat an infected wound with a systemic antibiotic. On the other hand, topical antimicrobials will only kill superficial bacteria, never the bacteria in the deeper layers. This also counts, of course, for the enzyme system. So it's not an easy job once your wound is clinically infected. And the second thing that we talked about are the different antiseptic agents available, their cytotoxicity, and a possible new alternative, this modified honey enzymatic antibacterial system. Thank you. You mean this enzyme system?
Yeah.
No, it's topical. It's topical only. It's like basically it's like this honey compound. Enzymes are proteins. As soon as you would put them systemically, I mean, they would be destroyed in the stomach, and we have no data whether you could use them via infusion or so. No data today. No. So it's topical.
Would it go into the deeper part of
No. I mean, I think it's fairly impossible for any topical antimicrobial agent to go into the deeper layers. And this counts also for the enzyme system. Yeah.
Philippe, can I ask, how shortly after a wound is established do you have the kind of cloning safety?
Sorry?
How shortly you advocate applying this system?
How soon after a wound is established?
How soon after? Would you use this in an acute wound as well? Or would you
I would definitely use this in an acute wound. Basically, the advantage is the absence of cytotoxicity. So you can use it as soon as the wound is there. I mean, why do we refrain from using antiseptics on a clean wound? Because on a clean wound, these antiseptics destroy human skin cells newly formed. But this is not the case for this enzyme system. So you might prevent infection by immediately using this enzyme system. But then topically, of course, yes. Also on acute wounds.
This, to me, looks like an hydrogen peroxide in the wound.
It's a kind of hydrogen peroxide, exactly, yes.
And hydrogen peroxide damages cells. And from what you say, because it is attached to the bacterial cell wall, it is not going to damage the cell, human cell.
Exactly.
But the bacterial cell wall is next to the human cell and next to the inside of the bacteria. So I can't see how the oxygen that is created is just going to get into the bacterial cell and not go into the human cell.
Well, it isn't, because it only binds to bacterial cell walls.
Cell wall, but if it is at the cell wall, when the oxygen is released,
Yeah.
it is next to the bacterial cell wall, next to the human cell.
But still, obviously, that is enough to be selective. This is, I mean, we've cultured human cells without bacteria even. And if you have human cells only in culture and you add the enzyme system, you also produce this peroxide system. Of course, the enzyme system starts to work, but there is no binding place. So there is no, I mean, human cells are not killed. It's enough to have a selective antimicrobial activity. It's enough.